whether we're professional caregivers or family members providing care. So we've chosen as our theme, caring for the carer, supporting those on the front line and in our communities. We have a distinguished panel of guests lined up for you this evening, and we're also hoping to hear all of your voices at the end in our discussion. So we're looking forward to that. And before we get into our content, just a little bit of housekeeping. Can we ask all the participants to please keep your microphones muted? This can be done by clicking on the microphone icon at the bottom left of your screen. This will ensure the best audio experience for everyone. We're looking forward to your questions and comments. Please post them to the chat. Note the chat icon again at the bottom of your screen. And we're happy to let you know that there will be a recorded version of the webinar available on our website at www.caripalca.org. At this point, I'd like to move along into introducing our guests who have been so patient with us this evening. Our first speaker is Dr. Ishtar Govaya. Dr. Govaya is holder of an undergraduate degree in liberal studies, 2 master's degrees in theological studies and psychology, and a PhD in personality and social context psychology. She's lecturer in epidemiology at the Caribbean Institute for Human Research, UWI, Mona, Jamaica. She's also a research psychologist specializing in mixed methods and implementation science. One of her areas of special interest is the health of Caribbean people, and in particular, holistic approaches to their mental well-being. Dr. Govaya is going to speak to us on self-compassion and self-care. Welcome, Dr. Govaya.
Thanks for having me. Shall I just go ahead now?
Yes.
Okay. Pablita, will you share the slides? Or have you been able to access the recording? Well, great, lovely. All right, so I wish to say a special thanks to CARIPALCA for this invitation, and particularly a special thanks to Dr. Cox, and a special good evening to the esteemed co-panelists. A thank you as well to Dr. Dingle Spence and to Dr. Stephen Smith, and of course to Pablita for helping to coordinate all of this today. I'm really happy to be speaking with you about self-compassion and self-care. Next slide, please. Pablita, I'm not sure if you're actually playing the pre-recorded version or if you're using the slides.
Hi, I'm sorry.
It looks as if it's the pre-recorded version. So if you just press
That's
play
right.
and use the volume.
Yes.
Are played. I don't know if other people are hearing. I'm not hearing.
I'm sorry. Are we not able to hear the volume? The audio?
No.
Oh.
So you'd have to kind of go rewind and press the volume icon. Yeah.
Okay, I will do that. The volume icon is to the highest capacity. I'm going to I apologize, everyone, for all of these technical difficulties. I wonder if we may be able to go to our next speaker, and Dr. Gravaya, I'll try to see if I can get your audio going, just in the sake of time.
Sure.
If you don't mind, my apologies.
Is that okay with Dr. Larson?
Okay.
Dr. Larson, is it okay for us
Yes.
to
Oh,
go
that'd
on
be
to
fine.
you?
Yeah.
Yes. So can we
Yes.
get your slides up?
Please. Yeah.
And I will introduce you while we do that. So we're really thrilled to have Dr. Larson with us this evening. He has recently connected with us in the Caribbean through Chaplain George, and has presented on a couple of our seminars in the past. So thrilled to have him. He has a Bachelor of Arts from the University of Chicago and a PhD from University of California, Berkeley. He's a professor of counseling psychology and director of graduate studies at Santa Clara University, California. A clinician and a researcher, he's a Fulbright scholar, a fellow of the American Psychological Association, and a member of the International Working Group on Death, Dying, and Bereavement. He has published extensively on end-of-life care, stress in professional caregivers, and on grief counseling, and is also author of the award-winning book, The Helper's Journey. Dr. Larson will be speaking on bereavement and secondary loss during the COVID-19 pandemic. Welcome, Dr. Larson.
Thank you, Dr. Cox. Thank you to the Caribbean Palliative Care Association, and to my esteemed fellow speakers. And I'm just really happy to be here. Good day. I come all the way from Silicon Valley, and I'm going to go pretty quickly because I know that if we're going to try to end on time, I don't want to have the other speakers have so much less time. So I'll be moving very quickly, but let me just say at the outset that, you know, I'm here in Silicon Valley in the United States, where we've been struggling with COVID-19 for a while. Actually, Santa Clara County, where I am, which is in the dead center of Silicon Valley, at Santa Clara University, you know, we had some of the first cases of COVID, and we've had a real struggle here. I just want to say at the outset, my heart goes out to everyone in Trinidad, and I'm hoping that you really, as a country, pull together and just follow the basic practices that we've learned really can make a difference early on in an epidemic, by everyone wearing masks. And I'm not a medical person. I think Dr. Henry can maybe give you better advice, but I'm been through this now, and the social distancing, or physical distancing rather, and wearing masks and washing your hands go a long way toward stopping this. And had we done that throughout the United States and had become politicized, I think we would be in a totally different position. So I'm really, my thoughts and prayers go out for you. I'm going to try to address some difficult topics, and I don't want it to be, you know, a depressing presentation, but I'm going to try to acknowledge the real, you know, the kind of thorny issues, the difficult experiences that COVID-19 and is bringing to us in terms of bereavement and secondary losses. I want to begin though by saying that, you know, right now, and I see the numbers in Trinidad, and I see you've had about 50 deaths, at least that's one statistic I saw, in 4,000 or 5,000 cases. You know, but it's something that's affecting everyone, I'm sure. And it's really important to realize that as we talk about these difficult experiences, and also when Dr. Henry and Dr. Gavaya talk about ways we can work toward greater resilience, it's important to realize that everyone is undergoing a lot of loss. And when I talk about bereavement, I'm not just talking about COVID-related bereavement. All bereavement, all are affected by COVID because we have this kind of separation that's created so many stressors for us. Go to the next slide, please. This COVID is affecting everyone. There is so much uncertainty. There is a loss, when we talk about losses, loss of freedom, loss of financial security, loss of safety, which I think is key is if we're understanding stress. Go to the next slide, please. We lost it there. The next slide is there somewhere. You know, maybe we won't have slides that might work better. I don't know. There we go. So we have the social distancing, which is a problem in many levels because it undermines, next click on the slide, is undermining a lot of our self-care because we can't engage in all the social support. We can't do a lot of the things, the normal rhythms of life have been disrupted. So we have lost some of our normal kinds of coping strategies as a result of this. And just isolation itself, we know from a tremendous amount of research, is itself very inimical to our health. Isolation is not good for us for lots of reasons, and social support is good for us. And this separation that we're undergoing, and just in general, is going to create all kinds of issues. But I'm going to talk specifically about bereavement. Next slide, please. So when we look at bereavement, what we found, and this was a presentation that we did for the World Health and Palliative Care Alliance, and we had a briefing note that I was co-author of, and it was with Bill Warden and Patty Annawalt and Stephen Connor and Diane Gray. And what we concluded was that this pandemic, for everyone involved, including professionals and family caregivers, as Dr. Cox said, we're really addressing both professional caregivers and family caregivers as well. So sometimes it'll seem like I'm speaking directly just to clinicians, but I'm really addressing everyone's experience. This is like creates an unreal experience when you can't go to the hospital to visit your loved one who's seriously ill. That is a very unusual circumstance, one that just militates against everything we've tried to do in person-centered, compassionate care in medicine. There's a sense of unreality. There's this experience of guilt about maybe I infected the deceased. We don't even know sometimes because we might have been asymptomatic and could have possibly transmitted it that way. Family members are just in a state of kind of ambiguous loss until they're advised of the decision regarding a disposal of the body of their loved one. These are horrendous experiences. So there's often at the end of life a lack of the compassionate physical touch with the loved one, which is really very awful. We know that this is one of the predictors of traumatic bereavement. What I've been saying for a long time now is that the novel coronavirus is creating a novel form of traumatic bereavement, because those end-of-life conversations, those times to talk about things. If you look at the situation with COVID, I mean, it's rapid onset, it's traumatic because it comes out of the blue, and it can be devastating, and suddenly you're separated from your loved one. Those are the ingredients for traumatic bereavement, and you don't have a chance to have those end-of-life conversations. Our social networks that are crucial in managing bereavement are undermined, as I've been saying, and it's inevitable that you're going to have grief being more complicated given these circumstances. So go to the next slide, please. I've written a paper in JAMA on end-of-life conversations, and my point there is that all these conversations that we need to have are essential, and they go from the initial diagnosis all the way through to bereavement care. And all of those are more difficult, and trying to do all those virtually is a real struggle. You know, one of the points I want to make is that it's not just the frontline people who are getting very severely affected by the COVID situation and caring for COVID patients and bereaved family members. As one spiritual care chaplain said, you know, the grief is pouring out of my computer into my home. So we can't compartmentalize. We have our home, and we are doing this profound and very emotionally involving work in our home, which is really something that's challenging for all of us. Next slide, please. And when we look at the stressors that clinicians have, and almost all of these apply to our family caregivers as well, our self-care practices, as I've been saying, like social support and exercising and nutrition and meditation, taking time off, setting limits, these are all undermined in this situation. That's why we really need what Dr. Henry and Dr. Gavia are going to be sharing with us in terms of how to address these issues and how to you know, strengthen our resilience. And the good news is that we know that we can strengthen our resilience. That is the good news. We can cope with this, but we have to take it on, and we have to directly address it and acknowledge it. We have, with COVID, I don't know, and forgive me for not knowing everything that's happening there, obviously, in Trinidad and your situation. But here in the United States, our health professionals and family caregivers have gone through so much work overload, and they've been just exposed to repeated trauma. And you know, we've all had the image of the family member on the phone saying goodbye to their loved one while the nurse at the other end, or the spiritual care person, or the doctor's holding the phone, and they're doing FaceTime to say goodbye to each other, having those final conversations, the I love you, thank you, forgive me, I forgive you, goodbye conversations. And that is about as poignant and powerful experiences as you can imagine, and stressful. It's so out of keeping with everything we've tried to support in terms of end-of-life care. And when that happens, and you know, we can have so many different problems. So we have isolation of staff from their own family members. And I'm sure for many of you, if you're exposed and you're working in the COVID area, you're going to have maybe some separation from your family when you come home. How do you integrate again? We've had extreme examples here in the United States with people sleeping in different rooms and in different parts of the home. Not, you know, I'm just saying that without dramatizing it too much, it's a very difficult situation. And you know, you could feel guilty taking time away from the clinical environment. And teams are disrupted. So how do we communicate as a team? We have to have, for the palliative care team, you've got to have your interdisciplinary team meeting virtually, which is very different. It's very different from sitting in the same room with Dr. Cox, Dr. Henry, Dr. Gavia. We're all sharing our experiences and talking to each other. It is different in this virtual medium. It's not as immediate, and it's harder to communicate subtleties and to share what's really going on for us. So this is a challenge for the team. And then wearing the protective equipment when you're doing frontline work, that is really burdensome in itself. So these are the stressors that we have that are, you know, there in caring for patients during the COVID, you know, pandemic. Next slide, please. Yeah, so family members and professional caregivers are vulnerable to burnout. Burnout is, you know, the demoralization you have when you feel like you can't do well. We're getting a better handle on how to treat COVID patients, but early on, there was really a lot of unknowns, and there still are a lot. So people their status can change quickly, and then you end up feeling demoralized. And you can have that sense of exhaustion, which is a keynote experience in burnout. Secondary traumatic stress with some of these very dramatic traumatic situations where a family member is so stressed and just wants to be with their loved one, and we can't, that's not happening, or they are separated from all the support that they need. So you have some very traumatic situations that we can have as professional caregivers, kind of a secondary traumatization or vicarious traumatization. But family members are being traumatized. So we have a lot of trauma mixed into all this, and that's what also sets the stage for traumatic bereavement. And then we have moral distress. And God, I pray that you're not going to be triaging ventilators, but we've got to really try to provide the kind of equipment that we need for caring for patients. It's really, here in the United States, I thought we wouldn't have that issue. Really not the case. We had so many situations where we didn't have the right equipment, and it's taken a long time for us to begin to address that problem. So these are big issues. Next slide, please. And I'm going to try to move along quickly because I don't want to take all. These are some of the things that I think we can do, that I think Dr. Henry, Dr. Kavia are going to talk about: being kind to ourselves, the kind of self-compassion, being mindful. Mindfulness has been shown to be a good stress antidote. To have that balanced empathy, not fall into what I call the helper's pit, to reappraise things, to always try to see, okay, how can we move forward here? How can I not go into a crisis each moment, and I can be able to see a challenge here? To try to do everything we can to strengthen our social support, do things for ourselves, take time to take care of oneself, take action, don't be passive, exercise if you can, and try to transform this loss. And I think ultimately, to connect with meaning and purpose in the work, because everyone in this room with us right now, I just think, connect with the purpose in the work for yourself. And that is really a pretty good stress buffer in itself, because it gives meaning. And, this is not easy. None of this work is easy, but it's powerfully meaningful. And what we're learning is that that meaning can really carry us on in the face of stress. Last slide, please. And what I'd ask you to do is to just think about your work, the good works that you're doing every day, rippling out across, the country, across generations, and that's something that can sustain us in these difficult times. So I'm going to turn it over to, I think we're going to go back to Dr. Gavia and then Dr. Henry. So thank you very much, and thank you for all the good work you do.
Thank you, Dr. Lawson, for that comprehensive look at secondary losses. Thank you for also reminding us that we need to have purpose and to remember our purpose and the meaning in the work that we do. I think that goes a long way. So we want to move on to Dr. Govaya, just checking in with Pablita. Are we okay with Dr. Govaya's audio, or do we go to Dr. Henry?
I think I need to take out the headphones, Pablita, that you're using.
Yes.
So
yes.
Then everyone should be able to hear the audio and the recording.
Yes, that is correct. Dr. Govaya, would you like me to start with your PowerPoint or your audio first?
The audio recording, the audio visual recording is good. Thank you.
Thank you.
Can you see the play button? Yes. And the volume? Volume isn't. I'm not hearing.
Okay. Pablita, I don't think we're hearing anything on the recording.
Are you still not able to hear the audio?
No, not hearing any audio.
Oh boy.
Can we do the
Okay.
slides, or shall we go on to the...
Go ahead to the slides, if she has the slides to show.
I do have the slides.
Okay, great. Thank you, Pablita. Just want to thank the participants for your patience and speakers. Really sorry about these technical difficulties, and hopefully we will have Dr. Govaya's slides up shortly so we can keep going. Pablita, how are we doing? Okay. All right.
Okay, next slide, please. In thinking about self-compassion and self-care, one of the main issues that we really need to think about is the balance between pressure and performance. There's been a lot of psychological research that suggests that we all need a bit of stress in order to perform effectively. And we need to be mindful of what our stress levels are, because if that stress level actually gets beyond our threshold in terms of management, that's when we start to see negative consequences. The negative consequences, particularly for those who are performing care work, can include things such as burnout, compassion fatigue, which is being reframed in the social neuroscience literature as empathy distress fatigue, and also vicarious traumatization, which Dr. Larson spoke a little bit about. Next slide, please. Before we deal with compassion fatigue or empathy related fatigue, empathy distress fatigue, it's really important for us to understand work context, because work contexts are the setting through which burnout is possible. These could be formal workplaces or informal workplaces, such as happens with home care workers, for example, or unpaid carers, such as family members who are performing these roles. And often burnout happens when there are mismatches in terms of workload, in terms of the control that you have as somebody who is working, and in terms of reward and fairness, because compensation is also an important aspect that can contribute to distress and can contribute to fatigue and can contribute to burnout, particularly when persons are having to deal with very different circumstances than they're used to dealing with. And especially in COVID times, when so many of our healthcare workers, our frontline workers, our essential workers are having to come to work and work in contexts and settings where there is clearly a mismatch in values, it's really important to think about what are the corporate values here and what are the human values, and whether or not there's a mismatch, because in those types of situations, burnout is really very likely. Next slide, please. So putting burnout aside for a little bit, let us try to understand a bit about compassion fatigue, or empathic distress fatigue, as it's being called. So what exactly is this? This is when empathy is fatiguing, when empathy can actually distance carers from care recipients, and also from giving the care recipient the best care that they can give. It has relationships with other constructs such as burnout and such as vicarious trauma, but it's really distinct in terms of your sensitivity, your compassion, and your empathizing, really leading you to be absorbing things beyond what you're able to manage. It makes it very hard for you to do your work. And in order to avoid burnout, which is the next stage, in order to avoid burnout, in order to avoid a loss of empathy and a loss of altruism, sometimes people need to take a break. This can be a temporary break, or it may actually involve permanent reassignment in terms of professions. Next slide, please. Who exactly is at risk for this? So carers, particularly professional carers who are paid, but also unpaid carers. These are persons who are providing care during disasters or pandemics, persons who are working longer hours, persons who are providing care, but they're losing more patients, they're losing more care recipients than they usually do. So if you work in oncology, for example, but you're used to a certain number of your patients, the people who are receiving care from you dying, but because of COVID times, that number is vastly increasing. This is a case where you are most vulnerable in terms of the empathic distress fatigue. And if you are supporting and helping others through tough emotional responses to crisis, you are also vulnerable. If you're working in a stressful environment, you are very vulnerable. And very importantly, persons who are doing double duty care responsibilities. So these are persons who have care responsibilities at their workplace, and when they go home, they are also undertaking care responsibilities. So that could be caring for young children. It could be caring for older relatives. It could be caring for a sick spouse, for example. So double duty carers are very vulnerable to empathic distress fatigue. Persons, particularly for whom time off is actually impossible if they're the sole radiologist at the hospital, for example. And they cannot take any time off because the other two radiologists, for example, are on vacation or on leave. They are particularly vulnerable to empathic distress fatigue. And people for whom it seems to them that it's impossible to take time off, they are most vulnerable. Next slide, please. So how can you recognize, the slide before this, please. How can you recognize compassion fatigue or empathic distress fatigue? Some of the key ways, some of the key flashing red lights are if you are really experiencing mental and physical exhaustion, if you are having a lot of trouble coping with your everyday experiences, it could be your interactions, it could be tasks that seem normally very routine for you to do, if you're really having intensive trouble coping with those. When you're also experiencing empathy that makes you extremely vulnerable to the experience of your patients or the persons who are your care recipients. They could be your supervisees, for example. That's where you are particularly going to be experiencing compassion fatigue or empathic distress fatigue. If you are exhausted, if you are frustrated and sad, if you're feeling very overwhelmed, if you're feeling lost, those are some common signs of compassion fatigue. Next slide, please. Charles Finley, who in the early 1990s first coined this term compassion fatigue, and which is undergoing now with the work of Kristen Neff and some other mindfulness related scholars, who first coined this term, he identified several domains in which compassion fatigue, as he called it, and as it's still actually called in many circles, several domains in which you can actually see signs of compassion fatigue as well. So those are cognitive. They include some of the emotional signs and symptoms that we've already spoken about, behavioral signs and symptoms as well. Really importantly, particularly during this time, or when people are having disturbances in their sleep, when they're hypervigilant, when they become very accident prone, when they're losing things, people feel really just very shaky. And really important for us in our Caribbean context, in Jamaica, for example, where, as many of you know, we have the most number of churches per square mile compared to anywhere else in the world. People have a real sense of identity with their spirituality and their religion. And when you start to question the meaning of your life, when you start to question your religious belief, this can be another sign or symptom of compassion fatigue. It also manifests in your personal relationships, and it can manifest with some very physical symptoms as well. Next slide, please. So what do we do? Once we can recognize it, once we believe that we are at risk, once we know that we are belonging to a vulnerable group, what can we do about it? One of the most heavily evidenced strategies for dealing with empathic distress fatigue is support. Dr. Larson mentioned support in his presentation a little while ago, but support is really essential. You have to seek support from your colleagues, and these are people who are doing similar work to what you're doing. The evidence suggests that it's really important that you stay connected with your peers, and it's peers with whom you have a safe space, not peers that you know are backbiting peers or peers that you are feeling uncomfortable around. These are people that you can take a risk with in terms of sharing and receive some type of advice. They allow it to feel safe for you to vent so that you can actually get to the types of issues that you really need to connect with others on. Support can also come in terms of consultations, and it can come as well in terms of supervision. This is really important for those of us who are in helping professions, who are in caring professions, whether they are professional caring professions or unprofessionalized up to this point in time caring professions. It's also really important that you have things that are other than your work, things that can be outside of your work domain, outside of the main relationship that has you in that caring role, things that sustain you. So there's a lot of evidence that suggests that having those types of activities, having those types of outlets is really important in terms of managing emotional, empathic distress-related fatigue. Exercise, as Dr. Larson pointed out, laughter, finding things to laugh about, finding things to smile about, humor, watching a comedy, exchanging little memes and gifs with your friends in your social media communications. That's really important in terms of managing fatigue. Taking a break is really important. You need to reset and recalibrate as frequently as you possibly can. And it's really important as well, and there is extensive evidence around this, to cognitively reframe. To cognitively reframe, what does that mean? It means that when you're inclined to think about and to verbalize to yourself things in a negative way or in a cynical way, that you encourage yourself to say it a little differently, to express it a little differently, to consider it a little differently. And you try to reframe for optimism and for gratitude. You try to find something to feel grateful for or thankful for in the situation. And also making time for self-care. Next slide, please. Making time for self-care has to be something that is priority. And this is one of the key evidence-based strategies in terms of managing empathic distress fatigue. And it's that you have to really understand what the whole universe of potential self-care strategies are. And within specific domains, you pick and choose. Everyone is different. Everyone has different types of needs. Everyone has different things that they're drawn to in terms of coming up with your unique profile, your unique portfolio of your self-care activities. So you are to find your self-care practices, and they're exactly that, practices. So it's essential that you practice them. And you must practice them unapologetically. So if you're in a relationship and you like to listen to 80s music, but your partner doesn't like to listen to 80s music, find your headphones. Put on your headphones and listen to your 80s music if that helps you feel better. You practice your self-care practices unapologetically and fiercely. You have to be really protective about this time and the space for your self-care. Next slide, please. It's only when we engage with all of these evidence-based strategies, evidence-informed practices, when we really try to pay attention to ourselves, that we see a different type of curve than the Yerkes-Dodson stress curve. So this is a curve where we move from the depth of the compassion fatigue to what we are referring to as compassion resilience. And again, Kristen Neff and her colleagues are doing an incredible amount of work in terms of mindful self-compassion and specific individual level approaches to manage stress and to manage empathic distress-related fatigue. Because often we start doing our work, we start doing our activities in a way where we feel really satisfied. We saw this a lot at the beginning of the COVID pandemic. People felt really energized. There was a certain level of anxiety, but that could have very quickly flipped into excitement and a sense of purpose, a sense that I'm really needed here, I'm needed to make a difference. And so that compassion satisfaction, it's a good place to be in terms of really having a sense of fulfillment with your work. But if you are chronically over empathizing and you're experiencing this empathic distress fatigue, you really move into this fatigued state, and you need to practice all of these evidence-informed strategies and others that resonate with you to get to this point of compassion resilience. Next slide, please. So I just want to thank everyone for having me on today's session. I want to thank especially CARIPALCA for coordinating and organizing this, because our healthcare professionals and those of us who are just continuing to work during this period of this pandemic really need as much support as we can possibly get. One of the key projects that I'm involved in, along with a really stellar team of persons, is the STRIDE project. And I really wanted to encourage folks, if you are an unpaid carer, if you are interested in understanding more or curious about dementia care and improving dementia care for the Caribbean region, please reach out to us and let us know about your interest, and we'd be happy to be in touch with you. Thank you very much.
Thank you so much, Dr. Govaya. Sorry, is everyone hearing me?
Yes.
Okay, yes, great. Yes, thanks, Dr. Govaya. So thanks for introducing us to the new terminology about empathic distress fatigue, reminding us of the signs and symptoms of burnout, and particularly for that reminder that we must practice. We have to schedule in these self-care activities if we're going to get to that point of resilience. So we really appreciate all of those reminders. We're going to move on to Dr. Henry, who's been very patient through all our difficulties this evening. He's our third and final speaker. So just to introduce Dr. Damien Henry, who received his MBBS from the University of the West Indies and went on to complete his Master's in Public Health. He's a fellow of the Caribbean Healthcare Leadership Institute and currently runs a rural general practice on the island of Barbados, where he focuses on holistic, Christ-centered healthcare. He has about 10 years experience in the field of palliative care, and he's going to be speaking to us on practical approaches to self-care for the caregiver. Welcome, Dr. Henry.
Thank you very much, Karen. Thank you, esteemed panel, Dr. Govaya and Dr. Larson. You've actually made my job very easy. I think you've covered a lot of the aspects that I already have to touch on. They present the science. I'm just basically going to present the more practical approaches. In the interest of time, we can skip through the first two slides. We can skip through those. That was just basically some objectives. Next slide. And let's just get right into some research. I actually pulled up, when I was given the topic, I was actually starting looking for things that spoke to the impact of COVID on caregivers. And I actually found this study. It's actually published on the internet. You can actually see the thing at the bottom there. We're looking at the impact of caregiving on mental and physical health. And this was actually done by Blue Cross and Blue Shield in the United States. It's a quite big study, and they looked at, they had about a couple million persons, all insured by Blue Cross and Blue Shield. some of the key findings basically from this study was that at least 6.7 million Blue Cross and Shield members were actually acting as caregivers during COVID for either their spouse or children. And when they looked at these individuals compared to the benchmark population, so other Blue Cross and Blue Shield members who were not caregivers, there was a 26% greater impact on health conditions. And this was actually broken down in a very interesting way. We looked at like adjustment disorders, there was a 36% more increase there, anxiety, 34% above the benchmark, major depressive illness, 37% above the benchmark, tobacco and use disorders, 42%, obesity, 50%, and hypertension, 64% above the benchmark. Just basically showing a big disparity in health between those persons who were caregivers versus persons who were non-caregivers. So there's a tendency for persons while caregiving to take the negative and not look after themselves well. There were health differences associated with persons who were millennials in terms of persons who were under the age of 37, between 37 and 21, 37, versus Generation X, which is like 38 to 53, and the baby boomers who were 54 and under 65. And what they found is that those persons who were the millennials, they had more pronounced healthcare issues, more anxiety, more depression, and they didn't handle it as well as persons who were both the baby boomers and the Generation X. There are also disparities which looked at like races, basically Black versus Hispanic versus white communities, and they found that persons in the Black and Hispanic communities were more likely to be caregivers than persons direct caregivers, in the sense that they had persons in their home looking after, as opposed to persons in the Caucasian population. And also in terms of how they dealt with the stressful issues, these were also various things that were different between different groups. But long and short of it was that most persons who were caregivers were under a far more greater stress than persons who were non-caregivers. And this was actually amplified by the whole aspect of Corona, because there were people who never thought they would be caregivers, especially millennials, who ended up being caregivers during Corona, and they were very fearful of what would happen and how they would actually manage and cope with this. Next slide, please. So, in looking at caregivers and the impact of stress, people turn to negative coping mechanisms, which is always easy to do. 14% of persons relied on alcohol, 18% looked at other drugs, and there were about 50% of persons who coped with food. You need to go for a few slides. Right. 57% of the overall caregivers reported significant levels of anxiety and stress and depression. And this point was actually well made by previous speakers. So the question is, how do we get around this? Next slide. There was a concept that was introduced to me way back in, I think, 2014. I think Karen was at this workshop as well in Trinidad, where a lady, I can't remember her name exactly, she uses this concept of the dipper in the bucket, and it was a theory that was actually put forward by Tom Rath and Donald Clift. And it basically that everyone has an invisible bucket. This bucket is being emptied or filled. And Dr. Gouveia actually brought this concept out in terms just now very clearly. And our experiences, things that we go through, will determine whether or not this bucket stays full or empty. If our bucket is full, we feel great and we have a good life experience. If our bucket is empty, we feel really awful. Now, everybody also has an invisible dipper. And we use this dipper to either fill other people's buckets. So when we do acts of service and we do things that are nice, this evokes positive emotions. But the thing about it is that if we keep doing this constantly and we're not being replenished, we kind of burn out. The opposite is also true. If we use our dipper to say bad things about people or become involved in negative activities, that actually kind of results in us actually kind of depleting our own bucket. So the thing about the dipper and the bucket theory is that this is very important as caregivers for us to have a full bucket. We can't give or we can't help if our bucket is not full. And this is basically a simplified version of what my two learned colleagues said before in terms of, from a psychological standpoint, in terms of helping people. We need to be able to be in a good position mentally. So how can we do this? How can we maintain this good mental health? and maintain good physical health and be in a position where we can actually be a good carer and have those resources. So next slide, please. Let's look at 8 practical principles that would actually help. Now, these things were said by the previous presenters, and I'm just basically reiterating them. Nutrition. Now, we realized that 50% of persons who were in also cope with food as an option. So most times when people are stressed, people basically eat emotionally. So they pick things that are comfort foods. They may be sweet, salty, fast food. A lot of the food choices may be not necessarily the best choices. And when you're in a disaster or a stress situation, even working in COVID, food is not necessarily an easy commodity to come by. And you find that you eat what is available. Sometimes what is available might not necessarily be what is healthy. And you really have to plan your meals well and basically decide that you're going to eat a nice balance there. I usually tell people, imagine your face, a clock face as your plate. When you're eating, you're supposed to have a quarter of your clock as starch, a quarter as protein sources, whatever you want to be, lean protein, preferably less red meat. And the last half of your plate is supposed to be vegetables. And this is just a kind of simplified way of putting your plate so that people would actually, if you eat this way, you know that you are having a pretty balanced day. Avoid stress eating, as I said before, and reduce or replace fast food with healthier options. So if you know you're going to eat fast food, you need to actually plan on what the stuff as opposed to like waiting to rely on what is actually available. So in my case, like at work, what I do is actually walk with like fruit. And even if I can't get, to have a thing, my full lunch, I can actually have some fruit to snack on and stuff like that. And I find that works. Try not to skip meals. The thing about that is that, yes, we're working long shifts, and the scary part about it is those of us who are working in clinics and stuff who have to wear personal protective equipment. It is sometimes a stress to actually take a break to eat, or to take a break, to do anything, because taking a break means taking off your PPE and having to, sanitize again fresh and then do a whole set of stuff just so that you can actually, get a quick bite to eat. So a lot of times people say, well, hey, you know what, can't bother with that, I'll skip that, and find yourself eating at the end of the day, and that is not healthy. Exercise was basically mentioned by both colleagues before, and it is vital. I said do something physical. Exercise does not necessarily mean going to the gym because, and that's the next thing, during COVID, a lot of people's exercise routines were really messed up. People had gyms, people had, groups that they would go to, like CrossFit is a big thing in Barbados. People exercise on beaches and stuff like that. And when countries went into lockdown, all these things were disrupted. So you had to find new and innovative ways to exercise. My personal testimony during COVID, we actually started walking around our house because, you couldn't go out. So me, my wife, and my daughter would walk around our house. Kind of boring at first, but after a while, you kind of look forward to it every evening because it was some activity to do. And the neighbors would also walk around their houses as well. And it became a little thing that, we started exercise more as a community. And you're walking around, you're talking with your neighbors who are next door to you, and it gives you an opportunity to. The other thing is, if you can't get really out to exercise, invest in a pedometer, which kind of gives you an idea of how much steps you're doing. And your target basically is at least 10,000 steps per day. If you're a person who works in a hospital environment and you're up and down and moving around, it's a great device to have. If you're working in an office, it may not be as much. But the thing about it is that you're targeting to get in that 10,000 steps. So if you only do 6,000 a day, when you come home in the afternoon, you actually have to get in your other 4,000 steps. Getting a buddy. And the buddy blocks into the whole support system as well. So if you can find somebody who you work with, or a family member that you can walk, talk, or exercise with, it gives you an opportunity to kind of debrief as well and to kind of share your day and kind of unwind. So these are just some practical things. And if you're exercising with a buddy, the day that you're not motivated, at least you have somebody who's going to push you to actually keep doing it and get you more fit. And the thing was that once you're exercising, you're helping to manage those excess calories that you might have been taking in, and so that you avoid the issues with obesity and stuff like that, which contribute to poor health. Next slide, please. Right, water intake, also very important. Again, because in the whole COVID environment, wearing a mask, and this is one of the things I struggled with initially in terms of having to schedule times like every hour stop. take off masks, sanitize, take a break, have something to drink. What initially happened during initial months of, well, first couple of weeks of COVID is when you start work and you're working and you're trying not to take off your mask because you're just trying to get through as many patients as possible or whatever. But by the end of the day, you realize that you're horribly dehydrated and you're really not getting in your fluid quotas that you should be. So you find when you get home on evenings now is like really, really thirsty and you're kind of trying to catch up on so much water that you would have missed out on. So you really have to kind of basically take a mental break and say, well, okay, I'm going to stop. I'm going to have something to drink. In terms of avoiding the weight, excessive weight, avoid things like juices and sodas, those are not healthy for you and they will cause you to put on more weight. And just a quick formula in terms of calculating how much water you should actually need. Your weight in pounds multiplied by 2/3, and that gives you an idea of how much water you should be taking in by ounces based on your body weight. And lastly, reduce alcohol intake. This is something that, when you're stressed, it's very easy to, pop a beer or pop some sort of beverage just to kind of escape. But this escape kind of results in maybe activities and actions that you may regret in the long run. And it's not good for your general health in terms of, increased risk of heart disease, diabetes, hypertension. So these are things as a carer, if you are not well, you can't look after someone else. And if you're intoxicated, obviously the judgment decisions and stuff that you're going to make in terms of looking after other individuals are actually going to be poor. Because a lot of the times we don't have a ton of downtime. Sunshine in our part of the world is easy to get, but funny thing is that there's so many of us, because we leave for work very early on mornings and get back home very late at nights, we tend not to see the sunset or rise, and we spend most of our day indoors and not really seeing the sun or being in the sun. So I usually tell people, at least 30 minutes, get outside, enjoy the sunlight, some fresh air. It might mean taking a break in the middle of your day, going by the beach or stopping by a park or something like that. A personal thing for myself is basically I try to watch at least one sunset or sunrise per week. And this is just basically part of my me time, which Dr. I spoke about earlier in terms of basically having that time that is specifically for you and you guard it with your life. And this is your special little time. And whether you're a morning or evening person depends on the general thing. Get next slide, please. And this is basically a picture of one of a sunset not far from my house. I think I took this around somewhere in COVID. As opposed to going home, I actually walked onto a pier and just sat there for a few hours and got a nice sunset. And it just gives you, a nice relaxing feel. And it kind of brings you down from the day that you would have spent kind of running around and doing different things. Next slide. Temperance is the next option in terms of, what temperance is basically mean a balanced life. Yes, we must have time for everything, but most importantly, there must be time for me each day. And if I don't have time for me, I can't have time for others. If you lose that life balance, one of the things is that you actually lose your ability to cope. Life is more than bills and work, and we can always find more time to work and more bills to pay. But the truth is, we need to take that extra little time for ourselves every day. You may not have a lot of time, especially if you're somebody who's a lone radiographer, or that doctor what I spoke about, or that person who is looking after their at work, they're working as a caregiver, and then at home they have to look after kids or an elderly relative. You still have to have that me time, that few minutes where you say, well, look, I'm going to take 15 minutes here. I'm going to shut down. I'm going to listen to my music. I'm going to meditate. Do something that you enjoy doing, and that's important. Sometimes it might be just as simple as just taking a little time on your way to a client. I remember I was visiting a client one evening, and it was kind of a pretty long day, and on the way to the client, I saw the sun was going down, and I was saying, well, that sun looks like it's going to be a really good sunset. So as opposed to rushing directly to the client, I actually pulled off into a nice little beach that was not on the way to the client. Beauty of living in Barbados in terms of small island. So as a beach, very close. And I kind of just sat on the beach, watched the sunset, took some pictures, and it was a really good experience. It was kind of like, 15 minutes of just, after a hectic day, and still being in a hectic day, just taking that few minutes to kind of refresh yourself so that you can actually, kind of reorient your mind before you go to that client and continue your long work day. And most of us know about these long days, but if you find that bit of time for yourself, it actually kind of helps to recharge you so you can actually keep functioning. Air, getting out in the outdoors, that, just sometimes working in a mask, not sometimes, working in a mask is very, very difficult. And that 5-minute mask where you take off your PPE and you go outside, you distance yourself from other people and just take a couple deep breaths in and out. It feels like if you've been released, and it's one of the best feelings. During that, you can practice some deep breathing exercises and some relaxation techniques. All these things just kind of help you just to function. And these are, just little, sometimes that 5 minutes is all you need in a day when you're being wound up. You're going from patient to patient to patient, or you have, somebody demand after demand after demand. If you're looking after your relatives, that's a kind of hard one where, you're constantly providing help or providing care. And one of the things I always say to my clients who are caregivers, you must have at least that little time, where maybe early in the morning or late in the evening, where you can actually just pull outside for a little bit. Because if you don't, you'll find yourself constantly, trying to do stuff for someone and just trying to make it through the next day, and you don't get those breaks. Next slide, please. I think this next one is just basically a picture of a sunset or sunrise actually. We can move to the next slide just to kind of break the monotony of my speaking. I think it's the last slide coming up here. The other thing is getting adequate rest, and sometimes this is kind of difficult, but I usually apply the principle of that, you don't have to get all your rest or sleep in one spell. 2 4s are 8, or 2 3s are 6, whatever you need. But if you break it down into small portions, you may not be able to sleep for 6 consecutive hours, but you can get 2 hours here or 3 hours here between your care demands, depending on what you have to do, and it adds up. The other thing is avoiding, the high energy drinks and high caffeine beverages. It gives you wings, but what goes up must come down, and sooner or later you crash or you burn out. So those are things I tell people, just try to avoid. I know sometimes when you're really tired and you want to pick up and you want it and you want to push through, it seems like, I'll grab this and I'll keep going. But then obviously you crash at some point in time. Spending time with your hobby each week, something that you enjoy doing. It might not be, if you like playing golf or cricket or whatever your sport is. Some people might just like listening to music or dancing. Whatever it is that gives you your buzz, make sure you have that special time every week. You may not be able to do it often, but at least once a week where you can actually have that time. This contributes to your me time. And last thing is trust in the divine, in terms of, as mentioned by both speakers before, that time to meditate, to connect. And all these things kind of help in terms of keeping your bucket full. It's impossible to share what you don't have. If you're really tired, if you're burnt out, you don't have much to give. So by having your quiet time and meditation and stuff, that allows you to kind of replenish and get yourself kind of refilled and help you to refocus. Sometimes just by going from point A and being so stressed, you lose direction and you can't, get your thoughts straight. And this actually kind of gives you a time to, to reframe and redirect, and gives you that positive outlook, which you would actually lack. I hope these few tips were enough to help. We have the last slide, which is, I actually enjoy fishing as part of my pastime. I think this picture was taken something last year, in one of my down moments where I just take a day off from work and I go and fish and turn off my cell phone. Thank you very much. I hope my few tips were helpful, and thank you to the rest of the panel. I think that, your presentations were great, and they offered, lots of information which we can actually put into practice. Better carers. Have a wonderful week.
Thank you, Dr. Henry. Thanks for that personal perspective on self-care and for reminding us to stop and look at the sunset. And also, I think we'll all remember the dipper and the bucket analogy, really useful. And thank you for tying in all the previous presentations. So to all our participants, this brings us into the question and answer part of our program. If you have not yet posted your questions, please do so now. You can click on the chat icon at the bottom of your screen. And hopefully we'll have some questions for our panelists. Just to get us started, if Dr. Govaya is still there, I wanted to ask her if she could speak just for briefly on, the intense guilt that family caregivers in particular tend to experience, and which so often prevents them from practicing self-care. How can we help family caregivers get around that?
It's a very good question. I think often guilt is I'm sure Dr. Larson as a counseling psychologist and Dr. Henry with his own vast experience with self-care and helping others can speak about this as well. But often I think guilt for when we work with persons, guilt comes because people feel a sense of, I should be doing this, instead of I really want to do something here for myself. And that contrast, that conflict between what people believe they need to do for others and what they need to do for themselves is where a lot of the guilt kind of ripples. It's like a domino effect in people's lives. So one of the main strategies is to talk, just to speak to somebody that they trust and communicate to them what exactly is it that is preoccupying them, what is it that they're feeling guilty about, what type of care or service or assistance are they feeling guilty that they're not providing this loved one with, and are there other ways for that loved one to get that need met, and is it really an emergency if the loved one doesn't have that need met. And often when we're working with persons, family members in particular, it's hard for them to have a sense of perspective because everything seems like an emergency. And so that's one of the main things that we really need to do in our role as witnesses to other people and their processes, is to help them reframe. Is this an emergency or is it not an emergency? Is this affecting this person's life, life or death equation, or fundamentally affecting their safety? And if it's not an emergency. And so what's the next thing that needs to happen here? Is it that need really does need to be met? It does not necessarily need to be met today. It could be met next week. And what are the supports that I could really marshal to help me get that need met for my loved one?
Thank you, Dr. Govaya. Would Dr. Larson like to add anything?
No, I think that's well said. I think, we've got to keep, guilt tells us something. It tells us that there's a need there, as Dr. Govaya is saying, but we don't want it to become self-blame. And we, similarly with bereavement, we have a lot of counterfactual thinking. Well, what if only I had? And that can also create a lot of problems. And sometimes we need to sort that out and say, I did what I could. And in the face of COVID, there's so many situations where we're all feeling like I just couldn't do what I wanted to do. And we know in our hearts we wanted to do that. So you've got to really, I think, going back to Dr. Govaya's point about burnout and the situation we're in, we have to at a certain point say, we're in a very difficult situation, and that's what's creating these dilemmas. And it's hard to get that perspective when your heart's being really, torn and you feel like I should be able to do more. But I think her advice is wonderful, to talk to someone about these experiences. That's where support groups can be so wonderful. I'm sure Dr. Henry's and Dr. Govaya have had a lot of experience with that, where we can share with others and get that instant empathy, like, oh yeah, I'm struggling with that too. Oh yeah, this is terrible. And then you don't feel like it's just me. The fallacy of uniqueness doesn't kind of take over.
Thank you.
Dr. Larson is basically in the COVID setting, is that even with support groups, bringing people together, especially the older folk who are not technologically savvy, is one of the things that we struggle with at this point in time. So the younger folk who are tech savvy, and we can get them on Zoom, or we can do, these various conference calls and stuff like that. Or the older folk who lose loved ones or who need that support, is very, very challenging. And the deaths that I've, like cancer-related deaths and other deaths I've really dealt with during COVID, that was our challenge in terms of getting counseling. We do calls, we do things, but it's the personal touch, as you said in your initial presentation, just being there for someone, you know, the social isolation, the social distancing, really, really, really took a serious impact. People coping with grief, coping with difficult situations. Very challenging.
Thank you. And a question for Dr. Henry again. What is perhaps the most challenging aspect of self-care as a palliative care provider in the Caribbean?
Well, in the Caribbean, I guess our greatest challenge is basically most of us are old. You know, in Trinidad and in Barbados, there are few of us who provide palliative care, and the demand is, you know, excessive. I'll give you a simple example. Recently, Dr. Graves is currently on maternity leave, and there are a number of us who are trying to fill in and cover the cases across the board. So it therefore means that you have your load plus another person's load added and another person's load added. And what happens a lot of the times is that, you know, patients call with, you know, inputs that, you know, I need to see you, you know, I'm having this challenge. And a lot of times when they call, it is at a time where you may be doing something with your family, and, you know, or you may be doing something for yourself. And, you know, you have to kind of, you know, deal with it gently, say, well, you know, hi, you know, if I don't, there's some things that are emergencies that have to be addressed. And you can actually, there are certain things you can reshunt, like in Barbados, there's like urgent care, and there are other practitioners that you can kind of reshunt them to. There are other situations that you may just have to listen out, you know, talk them through it, and then kind of, you know, say, okay, I can get back to you on this. So carving out your personal time is actually, I don't know if Dr. Webb has the same kind of challenges in terms of carving out that personal time for yourself is one of the biggest challenges that we have in the Caribbean, because resources are very, very scarce. And there are lots of people out there who need help. And a lot of times when they contact you, it's like, you know, hey, you know, help, I'm struggling here. And a lot of times you're just, you know, saying, well, okay, this is my little time. I'm trying to catch myself as well. And you kind of got to juggle a bit. And I think that's in the Caribbean, that's one of the biggest challenges. I don't know if Dr. Gabaya has the same kind of situation.
Yeah, I completely agree with you. I think often it's we're trying to take care of ourselves and practice all of these principles for self-care, but the needs of the people that we're interacting with are so great, and often they reach out to us when they are in crisis, when something is really not working well, when they're really concerned about something. And it's really a catch-22, because if you give people that access, then they will use that. They will use it. They will reach out to you. They will contact you. And it's really important for you to then be able to set clear boundaries. So I'm receiving the call because I've given you my number, my WhatsApp information, because the nature of the relationship means that you need to be able to contact me if something is wrong, if you have a serious concern about something. But then you need to trust my expertise when after I've gotten relevant information from you and have been able to make some type of assessment, can then decide if I need to come immediately, if I need to send somebody else if I'm not able to come immediately, or if I can actually check in with you in 3 hours time and see if you followed certain protocols, and done certain steps, if the thing that you're concerned about changes in nature. And I think that's something that we need to help people. Our role oftentimes is to really help people figure out how to manage a situation on their own, and to really help people understand maybe what you're experiencing now is a lot of fear, you know, and it's understandable that you may be feeling a bit panicked. But based on the information that you've given me, here are the things that I think need to happen next. And then we check in. So I think the availability, just to be able to to say, for somebody to have that sense of comfort that I can check in if I really need to check in is really important. And it's often something that's very, very different than, for example, in the US context or in the British context, where there are such stark boundaries sometimes between healthcare professionals and the persons that they serve. You know, they may not be giving personal information, contact information. And so because we are living in small societies where people may be our clients and we may be seeing them when we go to church or when we go to the grocery, it's not necessarily easy for us to have such stark boundaries in things. And so it's very understandable that we open up, but it's just about really managing that balance.
Thank you so much, Dr. Govaya. I'm afraid that we are past our time, so I think we need to be wrapping up. On behalf of the entire team at CARIPALCA, I just really want to sincerely thank Dr. Govaya, Dr. Larson, and Dr. Henry, you know, for taking the time to be with us, for all the insightful presentations and the helpful tips so that we as caregivers can maintain our well-being. Thank you to the audience, you know, throughout the Caribbean, and if we have anyone from beyond, for participating. We hope that you will look for future CARIPALCA events on our website, www.caripalca.org. Hopefully we will have fewer technical difficulties next time. We're a young organization, so please bear with us, but we're really thrilled to everyone. Thank you for joining us. Be safe, be well.
Thank you, everyone.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.